if we were to buy from these locally manufacturing companies, definitely the cost of paracetamol will be much lower than the imported one. Honorable Kimani, the issue of community health workers in this country is that there are some success stories with community health volunteers. And I'll give an example of Kisumu County. They are moving on very well because they are giving stipends to their community health volunteers. And because this universal health care, they were doing some tests on a number of counties, then we should learn from the success stories like the one for Kisumu, just to find out how has it worked. Then that is what we can move to the rest of the counties within the country, that these community health volunteers then get a stipend, and it can be done on a matching basis, that as much as they are employed by the county governments, then the national government can match that stipend, just to, to make them do more work. Then you spoke about the 2021 healthcare workers, and members through the chair, as you may know, as much as health was devolved, on Schedule 4 of the Constitution, there's distribution of functions. There's what was left with the national government and what went to the county governments. Recruitment of healthcare workers, most of it is happening at the county government. So then I shall be working with the county governments, and it's supposed to be collaborative. And I'm aware there are structures that have been put in place to ensure that the county governments are able to work with the national government. Then is to ensure that these healthcare workers are absorbed in their respective counties. So I may not be able to say that we shall give appointment letters, but once that discussion has happened, and I pray that this committee is able to approve of my nomination, then we should be able to work together to ensure that the workers are absorbed. As we know, most of the facilities in this country are ill-equipped. Even with the healthcare workers, there is a shortage. But also, the executive order, number 1 of 2022, has created a state department of health standards and professional management. So I believe under that state department, then the issues of professional management will be well handled as well in that state department. Thank you. Honorable Wandai, you are concerned about the cartels at Afya House, and I believe I am looking like I'm too weak to handle the cartels. But I would like to assure you that these cartels, having worked in healthcare and supply chain, I believe these are people that I have already worked with. It's just that on a small scale, but now they are on the national scales. And where I have worked previously, Honorable Chair, is that my mantra is P squared, R squared. P squared means process and procedures. R squared is rules and regulations. I am very sure that we will be able to break the cartels, but also be seeking the support of members through bills so that we improve on our procurement regulations and acts, so that we are able to deal with these cartels. Because at the end of the day, if healthcare is working, even the health of those cartels is taken care of. Honorable Junet, you asked about devolved functions in terms of the personnel and staff, and how to deal with the MOH and the counties. Honorable Chair, I am aware that we have intergovernmental forums that have been put in place. We have the Specific Health Sector Forum that brings together the CECs in charge of health from the counties. They meet quarterly, and they bring their issues from the counties to MOH. And the issues from these CECs of health then escalate to the Council of Governors. And therefore, I want to believe that the issue of healthcare personnel at the county level, then how the MOH will assist them, should be then discussed at this level. But I also want to believe that most of the time issues work when people are involved. And therefore, we shall be involving everyone, each of the health professionals from the counties, in decision making. NHIF, you asked, what is it that I will do differently? Through the chair, Honorable Jeanette, NHIF, as Honorable Gladys had said initially, is a bit fragmented. But the most important thing that I would like to let this committee know, or they may already be aware, that the population, the workforce in this country is about 16 million or 19 million thereabout. Out of this total population, 1 million is in public sector, 2 million is in private sector. So we have over 11 million people who are in informal sector. And these are the people that we are having a problem with in terms of registration and recruitment into the NHIF. So I will be working together with the county governments to improve enrollment. And through use of the community health volunteers, we should be able then to use them in terms of enrolling these people in informal sector. And you know, the people in informal sector, Honorable Chair and members, is that they rely on a day-to-day in terms of what they earn. Therefore, we have to devise mechanisms to ensure that even from the day-to-day, then we are able to help them to achieve the 6,000 monthly contribution to NHIF. But again, in our Kenya Kwanza plan, we are focusing on promotive, preventive healthcare, and therefore that will ease the burden in terms of healthcare needs. And the study shows that for every 1 shilling that you spend on promotive and preventive healthcare, you save 9 shillings in curative. So as an agent of the government, I'll be ensuring that then we focus more on promotive